Hello everybody and welcome to the first webinar of 2018 from NQA. I'm Terry Fisher and we're going to be discussing the migration from OHSAS 18001 to ISO 45001 and the process and the steps that can involve. So if you've got any questions throughout the broadcast, if you'd like to type them into the questions box, and then towards the end, we shall summarise the questions and work through as many as we can. Obviously, if there's several on a similar theme, we'll try and consolidate those together. But generally speaking, we'll answer your questions towards the end. Unfortunately, I can't give specific advice about a particular business or organisation, but I can only answer general inquiries about the standard and the implementation of the standard. So, firstly, why implement 45001? It should drive forward OHS performance, encourage cultural change based on risk-based thinking and worker engagement. It should be proactive throughout, and it's based on risk management, and it demonstrates a proven commitment from the organisation via its leadership, its action leading to improvement. As we've discussed several times before, ISO 45001 structure is based on Annex SL. We're now discussing the contents of the FDIS, so that basically we're expecting publication before the end of March, but it could be as early as the end of February. We're waiting a final publication date. But the structure is based on the Annex SL as the previously revised standards for 14 and 9001, and it uses the same structure. We just received a first question about the assessment process. The question is, when will NQA be in a position to assess 45001 management systems? We can only assess to deliver a full registration program after the publication date of the standard. We can do pre-assessments, but they're not full certification assessments. We could only do certification registration assessments when the publication of the standard has been addressed. So the management system process itself, we're looking at cultural change and improved OHS performance throughout the organisation. And firstly, we need to look at the section of context of the organisation. So what do you do? What are the internal and external issues that you face as an organisation? What are the activities and purpose of the organisation? We also look at, in section 4, the interested parties. So whether that will include workers as the primary interested party, but it could also involve legal commitments, regulatory, commercial considerations, suppliers, etc., all based on and dependent on what the organisation actually does and what it's out to achieve. All the slides, for those of you who are interested and registered, will be available and sent out to you, and it will also be recorded and available. This presentation will be recorded and available via the NQA website. So all the slides, as we go throughout today, will be available and sent out to you. Within section 5 of the new standard, we're looking at the section on leadership, which involves the strategy, the policy, the roles, responsibility, and participation of the workers. Within section 6, we're looking at planning, hazard identification, risk and opportunities, compliance, obligations, legal and other obligations, and OHS objectives. Section 7 and 8, we're looking at the support of the operations, the resources, the competence, the awareness of people, the participation, the communication of that, and the requirements and documented information. We're also looking at the hierarchy of control, change management, procurement, contractor control, and emergency preparedness in sections 7 and 8. Then in section 9, we've got the evaluation of improvement, internal audit, management review, incident and corrective actions, improvement objectives leading to the improvement process for the requirement for system continual improvement over time. That's a very brief overview of the structure. When we're talking about the management system, it will help you identify the risks and opportunities. It'll help you manage those risks and opportunities, looking towards an improved risk reduction and an improved performance of the management system, and help you meet your compliance obligations, whether they be both legal and other requirements. Within the new structure of the Annex SL, the context and the workers and interested parties and understanding what the business and the organisation is out to do, who's interested in that and what they're interested in, and the leadership and the strategic direction of the business, all those three elements combined will help you define the scope of the management system. For example, with the context of the organisation, think about different contexts of the following types. A water company may be a public limited company. That will have a very different context and potentially very different interested parties to, say, a university. Obviously, an educational establishment, the needs and requirements of those two things and the activities undertaken would be very different. So what they're out to achieve and why they're out to achieve it would be extremely different between the two operations. A food manufacturer may be a private limited company, and a family-owned engineering business could be a smaller scale enterprise. And there again, they would all have very different needs and requirements, but can all apply the same principles of the management system throughout to identify the context of their organisation. Each is very different in terms of its organisational conditions, and this includes external considerations and internal factors and its interested parties. So in all of those, it's quite probable that they will all have suppliers, but what those suppliers are and what they deliver and what they require from the organisation could be very different depending on the various applications. So in the standard itself, the context of the organisation is broken down into 4 component parts. So it's understanding the organisation and its context. So what does the organisation do and why? Understanding the needs and expectations of workers. So workers are a primary interested party. Everything around 45,001 is based around the primary interested party being the workers, and then other interested parties are added. Only when you understand those expectations of the workers and other interested parties can you then look at determining the scope of the management system. And then there are requirements of the management system itself. What do you do? How do all these elements fit together? Because it's very important that you don't look at one clause of the standard in isolation to another. All the clauses interrelate, and throughout the standard, you'll find changes in one element will be influencing other aspects of the management standard. Obviously, performance, for example, can influence what's needed to be done and when. The competence requirements could change, there could be a change in technology. So it's how all these elements interrelate to each other that gives you an effective operating management system. Also, within the standard for 45,001, all the elements and all the clauses are applicable for full registration to the requirements. There are no exclusions or non-applicable elements within the management system. So when we're looking at external and internal factors, these may include a Pestel analysis, looking at environment, legal, political, economic, social and technological changes and requirements that are coming from outside the organisation. And you may use an internal assessment looking at strategy, structure, the style, the needs and requirement, the different staff, the various skills and the systems that are already in place. 45001 is designed to complement and supplement the core processes of the business. It's not just an add-on to the side of it. It needs to be integrated fully into the operations of the business to be fully effective. And this may take some time. So when we talk about workers and interested parties, just giving you a quick diagram there, there's some common elements, context being one of them within the new structure of Annex SL that may fit into existing ISO management standards. For 45001, we're looking at workers, managers, contractors, regulators, customers, visitors, members of the public, suppliers. There's a whole range of examples that you could add in there. And you can see there's some common elements there within 9014, customers, communities, suppliers, regulators, etc., etc. The context is a common element across all three management standards. Just something to bear in mind when you're looking at your management system. So the scope of the management system can only be defined after considering the context, the workers and the interested parties. Because unless you know what you're out to achieve and why you're out to achieve it, can you define the scope of the management system? In section 5 of the standard, in essence, we're looking at the emphasis on leadership, not just management, to enhance participation and engagement with workers and other interested parties to provide safe and healthy working conditions. This clause itself in the FDIS has been expanded. There are now more clauses going A to M, as previously it was A to K in the DIS 1. And in 5.2, the policy also needs to be available as documented information. The policy, the system requires it, and it's intended to provide a commitment to safe and healthy working conditions by the prevention of work-related injury and ill health. So it's not just about accidents and cut fingers, etc. Overall health issues are considered equally. Organisational roles in section 5, roles, responsibilities and authorities. The phrase accountabilities has been dropped from the DIS 1. The roles and responsibilities must also be available as documented information, which will also link into the communication of the roles and responsibilities. So how to make people aware, then it could be issuing them with various pieces of documents that explains the requirements of their role. In 5.4, looking at consultation and participation of workers. This is a key cornerstone of the management standard, and it's had some changes and some revisions since DIS 1. You need to consider the mechanisms and removal of barriers, so encouragement and support, etc. There needs to be allocation of time, resources, information, some commitment to communication and training as appropriate. Non-managers' participation to identify hazards and controls and establishment of various elements of the system, including policy. So although it is a management system, it isn't only just down to the managers of the organisation to define the various things. There needs to be participation and communication with the workers. And workers can include internal staff and employees, and it can also include external contractors or subcontractors, agency members, etc. You need to consider the engagement of the whole management system. Within section 6, we're looking at the planning, and this also relates to the operational controls within section 8. So in planning, it's a very important element of the management standard. It's quite extensive in the number of clauses that it contains. And planning is about defining the actions required to successfully achieve the OHS outcomes and objectives, to address the risks and opportunities and meet the legal and compliance obligations whilst engaging with workers. Accountability. I've just had a question on accountability regarding roles and responsibilities, so I'll just flip back to that just to make it clear. Roles and responsibilities can be defined, but ultimate accountability will always sit with top management. So you can define roles and responsibilities and make people responsible for their activities in which they have influence and control, but the ultimate accountability sits with the leadership team, the senior top management of the organization, and that cannot be passed down to subordinates. So just going back to the planning then, we're looking at planning. So within the FDIS, the hierarchy of controls is stated as a requirement, as an approach to be applied to the controls for an organization. And as you can see there from the diagram, elimination of a hazard is the most effective method. And then going down, substitution, engineering controls, administrative controls, and PPE. Obviously, elimination, get rid of the hazard within in its entirety. Substitution, so change it one thing for something that's less hazardous, or one activity or whatever, change the operation. Engineering controls, looking at guarding, protection, lockout systems, etc. Administrative controls are the work instructions and the various administrative and documented information that people can work to. And PPE. PPE being the last line of defense when it comes to risk control, because it only protects the individual and it's uncomfortable, etc. So this also links to into the participation of workers. If the PPE is unsuitable or uncomfortable, they're less likely to wear it, so they don't get the benefit of being protected, etc. And then that has an influence on the effectiveness of that control. So that's just a quick sort of overview of the hierarchy of controls, which is a requirement. We've got another question here. Under planning, reference to risk and OHS risk is made. The standard note the standard requires methodologies for the identification of risks and hazards and assessment, but not for risks. I don't quite understand the question. It requires you to identify and have methodologies in place that help quantify the level of risk, so you can prioritize what risks you're going to address in what order. So something that is a relatively small risk, and I'll use the example of paper cuts, for example, maybe there, but you need some order of significance. And so the risk assessment methodology is there to identify what are your priorities and give you some indication as to the significance and the impact potential of that risk and that hazard to that particular organization. So it's not saying what methodology you have to have, it's saying there must be a defined methodology so it can be consistently applied. There's quite a lot of questions coming in regarding risks and various things, risk identification from design, etc. Primarily, and I will use the hierarchy of controls as an example, if you can eliminate a potential risk or hazard at the design point, then you should do that, not only for your workers, but even potentially for the end user of a product or service, because at the end of the day, you don't want somebody to use your product or service and be exposed to an unacceptable risk. So the hierarchy of controls, and it should be considered at the design point, not just within the actual processing or development of that product or service. As I say, the planning clauses are quite significant. There's a general requirement in 6.1, hazard identification and assessment for risk and opportunities. And you'll see there I've written that where the standard requires documented information, I've highlighted that within the slides of the presentation. I can't go through each clause in detail because it would take too long, and plus it's down to you to interpret the requirements of the standard as it applies to your organisation. So I can't go into great levels of detail regarding the application of each clause. I can give you an overview of the general intent of the standard and the structure. And 6.1.2, determination of legal and other requirements. They're again maintained and retained as documented information. And then planning to take action. So it's no good just saying, oh, well, we know about that risk and we know about that opportunity, but we don't do anything. The whole point of the management standard is to be a proactive management system. So you must plan what action you're going to take. And to some extent, you must also consider if taking some action is going to introduce any new or revised risk, which later on it talks about management of change. So it's, like I say, it's a lot of these clauses are interrelated to each other. They don't work in isolation to each other. It's about the whole of the management system being applied effectively. So even just planning action can involve a re-evaluation of risk and opportunities to ensure that you don't introduce a different or greater level of risk than the one you're trying to correct or replace. In 6.2, the management standard looks at the OHS objectives and plans to achieve them. This isn't really anything new, but there again, the planning to achieve them is an expanded element based on the previous 18,001. So it's not just about setting objectives, it's about how you're going to plan and to achieve them, what steps you're going to take, and as I said, this can relate back to introduction and risk management for the opportunities. So one element of the management standard, the risk assessment element, can help define lots of other activities. So by doing the risk assessment and doing it in a systematic way and having the structure and applying that structure and that methodology in a standard approach can help achieve objectives, help identify objectives, can help identify risk controls and improvement, and go through the whole of the plan, do, check, act cycle with regard to we've implemented an action, we've reviewed the effectiveness of that action, can we do some more, is there something more, or did it deliver the expected outcomes from that activity? So that's the review, the improvement, and going back around the cycle of the plan, do, check, act. And the whole management standard is out to achieve the policy of the organisation and its OHS objectives. That's the fundamental requirement of the management system. Section 7, the support section. In essence, this section is centred on communication, and leaders of the organisation need to provide resources, information necessary for the establishment, maintenance and continual improvement of the management standard. So resources, information, training, competence, etc. all equal the support requirement within the management system. The actual clauses of the standard themselves. There you can see 7.1 is resources. We're looking at competence. So competence also applies to external workers, whether they be subcontractors or agency members, not just direct employees. And you need to define what competence is required for them to carry out that particular activity that you want them to carry out on your behalf. And that applies, as I say, for both internal staff and external. There needs to be an awareness. So workers need to be aware of what's required of them and the ability to remove themselves from work situations that they consider present an imminent and serious threat to life or health, and protecting them from undue consequences for doing so. So this goes back to the culture of the organisation and the context. If someone feels they are immediately under threat of injury or ill health or whatever, then it's quite reasonable to expect them to have the ability to remove themselves from that threat. And then there shouldn't be ramifications for that, or negative ramifications for that, you know, in so much as, well, nobody told you to do that, disciplinary issues, etc., etc. The primary responsibility of a worker is to protect themselves and their colleagues and co-workers. So if they can take action to remove themselves from a threatening situation or a threatening activity, they should be encouraged to do so, should that need arise. But it talks about significant, serious threat to life, not trivial. So that's where the standard's coming from there. Communication, the clause is expanded from the DIS 1 and various things in communication. Needs to include external and internal communication, and communication evidence shall be retained as documented information. That's not saying that you'll necessarily record every single conversation, but documented information could be an email, it could be a letter, it could be an email that confirms a telephone conversation, as in a summary. But you need to understand what you're trying to achieve by the communication and what was communicated. There's a full section within that clause on what you're trying to communicate, to who, why, etc. And documented information can be on a range of media, not just hard copy paper based information, and that information must be suitably controlled. So you need to give some thought to how your systems currently work. The operation, in essence, this is the organisation needs to plan, implement and control and maintain processes needed to meet the compliance obligations, manage risk effectively and meet the requirements of the OHS system. The structure of this has changed from the DIS 1. So the operational control, there's general requirements there, including maintaining documented information and adapting work to workers. So it's not just a matter of that's the job, just get on and do it. As required, you'll need to look to eliminate risk of workers by adapting the work to the worker. Eliminating hazards and reducing risk in 8.1.2, management of change in 8.1.3. So this includes introducing objectives and changes and various things like that. Introducing new processes, new workforce, contractors, whatever that be, that change can be many and varied, but you need to manage the process and make efforts to understand the potential risks and opportunities that that change will bring about. And it also includes procurement. And under procurement, they've included a general requirement for procurement, contractors, and outsourcing requirements, which is a change from DIS 1 and 2. This is talking about the FDIS, which is the final draft international standard. And then in 8.2, we've got emergency preparedness, and that again, what you're prepared for, what your responses shall be. There needs to be maintained and retained information which is documented. So documented, as I've said earlier, could be information on spreadsheets, electronic systems, hard copy documents, etc. Section 9, we're looking at performance. And having carried out all the various activities in the previous requirements, they're looking at the monitoring and measurement and analysis of the performance evaluation of the system and the activities and the controls associated with. So there's a general requirement there, and some of that needs to be retained as documented information. The evaluation of compliance is changed from DIS 1, and that needs to be retained as documented information. The relatively standard, pardon the pun, internal audit requirements remain very similar to the previous 18001 programme. There again, it must be documented. And the management review, there is a wording change for various clauses, but retained as documented information. Then last but not least, the improvement clause of the standard. So, the enhancement of OHS performance is a fundamental objective of the management system, and Section 1 requires action to achieve this. So that action could be based on your objectives, it could be based on incidents, non-conformity, etc. We've dropped the term preventive action from the management standard because the whole of the management system is a preventative management system in its entirety. One of the primary cornerstones of the management system is the prevention of injury and ill health to workers from occupational activity. And then going into continual improvement by enhancing performance, promoting a culture of support, worker participation in those improvements, communication, and retaining of documented information. As I say, that's a very simplified overview of the requirements of the standard. So based on the leadership, another core activity, depending on what the organisation is set to achieve, what it needs to achieve based on its interested parties and its context, etc., and the strategic direction of the organisation. That's the Plan, Do, Check, Act as it applies based on the leadership requirements. It looks at internal and external issues, context of the organisation, the needs and expectations of relevant interested parties, and from the other side, protection of workers, engagement of workers and participation, culture change, with the outcome and intended outcome to achieve fulfilment and satisfaction of legal and other requirements or compliance obligations. So, as I say, that is a very whistle-stop tour of the requirements of the standard. We have available to everyone a gap analysis document which helps explain some of the terms and terminology and can guide you through the process of migrating from 18,001 to 45,001. But, you know, remember, if you urgently require an occupational health and safety management system, 18,001 is still a valid management system, and it has already been confirmed that there will be a 3-year migration for anyone currently holding 18,001 registration following the publication of 45,001, which has been the norm with all the revisions to the various standards. So if you need to, you can use 18,001 and then transition / migrate across to 45,001 at a later date within the 3-year program. Some practical tips. If you're starting from scratch, read the standard. So we're looking at 45,001. So as I say, just to remind you there, 45,001 may be published by the end of February, but certainly should be published by the end of March 2018. So identify sources of legal compliance and information and other requirements based on your interested parties in the context of your organisation. Review your hazards and risk assessment process for risks and opportunities. And look at conducting a gap analysis to identify improvement points between your existing system and what you would need to do to achieve full registration to 45,001. And if you've got an existing OHSAS 18,001 system, again, read the standard. There's a lot of information in the standard, both in the clauses, and there are guidance notes at the end of the standard to help clarify the interpretation. You can conduct a gap analysis to identify improvement points. You can do that internally, and you can also have it done by an external body such as NQA. We can come in and do a gap analysis on your behalf. I've got a question here. It just says, if you've not got any standard yet, surely it's better to go straight for 45,001. It depends on your needs and requirements. As I say, anybody who's already embarking on structuring their management system to 18,001, if they haven't got a formal registered system and they're 2/3 of the way through that, it can be appropriate for them to adopt 18,001 and then migrate at a later date. Or it could be, as soon as it's so near now the publication of 45,001, you may well be as well going straight for 45,001. It all depends on your individual organisational requirements and how far you are down that line at this point. So the decision is yours, basically. All I'm saying is anybody who is already going down the 18,001 path, you've still got options. It's still appropriate. And anybody who's looking to have a very fresh start and looking at the first toes in the water at an occupational health and safety management system, then you're probably as well looking at 45,001 if you haven't done any background work and implementation work to 18. Be prepared, get ready, but remember, as we said earlier, migration of certification is not possible until 45,001 is published. It's still in its FDIS state as we speak, but the publication date is estimated to be end of February, certainly by the end of March 2018. So we've now got lots of questions and various things we can look at. No, it would appear that all the questions have now disappeared from the screen. So if anybody has got any burning questions that they need answering, by all means type quickly and we'll try to answer them. What we will be doing is we'll be reviewing the questions that you've asked and putting together some form of blog or an article that we'll be publishing on our website to try and answer some of those questions. A couple of questions just come in. Are any more changes due? No, the FDIS structurally should remain intact. We're not looking at any changes to the FDIS. In principle, it should be, to all intents and purposes, the final standard version. Late question again. One of the attendees came late and missed the first opening statement. So yes, all those of you registered for this presentation will receive a copy of the slides and the commentary. Thank you all for listening. I hope you found it useful. I know it's been a whistle-stop tour, but as I say, we can't go into great levels of detail. We can only give you an overview of the standard requirements. So I'd like to thank you all for attending. I hope it's been useful, and our next webinar is in early March. So I hope you can tune in for that, where we should be able to give you more information if there has been any changes or the requirements to the standard. Thank you all very much.